Hi, Mrs. Jones. My name's Vincent. We met when I was consenting you for the procedure. I'm just going to introduce you to our whole team in the lab here.
My name is Vanda, physiologist.
Graham, radiographer.
Hello.
Andrew, consultant.
Grace, nurse.
Hi.
Okay, so we're all going to be looking after you today. Now, the first part of the procedure is making sure we've got the right person in the right place, okay? So could I just get you to confirm your name and date of birth for me?
My name is Mrs. Ann Jones, and date of birth is 11/11/1954.
Brilliant, and I'm just going to check the hospital number. It's 12343456.
That's correct, and she has a red wristband.
Okay, brilliant. We're going to do a diagnostic angiogram query proceed on Mrs. Jones today. Now, the red wristband, you're allergic to something, is that correct?
Yes, penicillin.
Okay, brilliant. We're not going to use any today, don't worry. Now, Mrs. Jones is going to undergo a diagnostic angiogram query proceed. We're going to use her right radial artery. She's got a bit of a weak artery, so if we could just have the groin prep before we start. We're going to use a JR4, JL35 catheters, as we've discussed earlier on in the day. There are no specific concerns from our side. We may use IVUS or pressure wire. Are they available for us?
Sure, they've been used in lab 1. Well, I'll get it.
Okay, brilliant. We went through earlier the blood tests. They've come back with a hemoglobin of 125 and a creatinine of 65, so we're happy to proceed. There are no additional bleeding risks that we're concerned about. Anne's on dual antiplatelets and hasn't had any problems. Myself and Dr. Rag have reviewed the previous angiogram. There's some residual disease in the right coronary artery, which is for assessment today. And it said on your record that you have asthma, is that correct?
No.
You don't take any inhalers?
No.
No, okay. In which case we can proceed to FFR if that's deemed necessary. Now, Ms. Jones has diabetes. She's just had her BM checked. It's 9.6. It was a bit higher earlier on today. So could I just, Vanda, if I could just ask if you tell us after half an hour so we can check the blood sugars while we're doing the procedure. Is there anything else anyone would like to bring up before we start?
Fluids and sedation?
Yeah, so we'll use 1 milligram of midazolam and we'll get some fluids going. She's got normal LV function from a recent echocardiogram.
Does she need a LV assessment?
No, so we'll be all right. We've got that at recent echo, which we can use. Can you just make sure that we're going to be using x-rays today, so if everyone has their radiation badges and their appropriate letting on before we start.
Okay, great. Thanks, everybody. We'll get started.
Thank you.
Thanks.